2,600 new COVID-19 cases reported in Utah yesterday, along with 8 more deaths, raising the pandemic's death toll to 718. Our 7-day rolling average is just under 3,000 daily cases with a positive test rate of 24%. There are 484 people hospitalized right now. All of that information showing us just how serious this situation really is in Utah.
Yeah, but the Salt Lake Tribune's Robert Gerke says we have a chance to get a handle on the virus. He joins us this morning via Zoom. Robert, good morning. Nice to have you with us.
Yeah, absolutely.
Let's talk about then why you think we have an opportunity here coming up.
Well, I mean, I don't know if this is a silver bullet. It's not a silver bullet, but we've been talking a lot for the last several months about schools and the impact schools play in the spread of this virus. And we're heading into the holidays now. We've got the Thanksgiving break coming up. We've got Christmas break a few weeks after that. And it seems like it's a good opportunity, at least as it applies to high schools, to use that as sort of a circuit breaker, a reset, a reboot to how we approach, education. Education, I think, from the start has been one of the hardest parts about this virus because it's so important in so many ways to so many kids. For a lot of kids, especially low-income kids, it's where they get their meals. They don't have the resources at home to do online education. But we're seeing now in the last couple of weeks, so many of these schools moving, particularly their high schools, online. 25 schools moved online. Most of them were high schools because they just can't, when we have so much virus in our communities, they can't control it. They can't keep it out of the schools. What's out in the community is going to come into the schools, as one epidemiologist told me when I was researching this. And so we can use this as it applies to high school students who have the highest rates of spread to leverage these breaks to have as little disruption as we can in the schooling of these kids, but still kind of create that space, that distance, and try to get this under control. Now, I want to be clear, schools are not the only problem here. We've got other things that we need to still address. But we've seen states like New York, Washington, Michigan last night announced that they're going to be moving their schools online and they're doing it early because they want to keep things from getting out of hand, like we've seen here. This isn't the only thing. Like I said, it's a layered approach, but this is one layer that we can look at, I think.
Hey, so Robert, are you strictly talking high schools? I just want to clarify, because it's like a whole nother set of problems when you get into the elementary schools. If you've got both parents working and suddenly they need, daycare and a teacher.
Yeah, that's exactly right. I think with elementary schools, it'd be more disruptive. We also, frankly, just haven't seen the amount of spread that we've seen in elementary schools as we've seen in high schools, and junior highs are somewhere in the middle. I talked to the director of pediatric infectious disease at the University of Utah, and he said there's sort of a consensus around the country that elementary schools are doing pretty well. They're less mobile. They interact less outside of the school setting. They're good. They've been doing really well, frankly, at keeping their masks on, from anecdotal reports at least. And so I think we can keep those elementary schools in and maybe not provide the same amount of disruption. But these high school kids spread the disease, according to some studies, as much or more than adults. There's really not that much difference between, say, a 17-year-old high school senior and a 25-year-old who's working in the workplace. And so we kind of have to treat them differently, right? And so I think if we do this, if we focus this just on high schools, again, take this, if we have schools online for 3 weeks, from December 1st to December 21st, we really only disrupt about 15 days of education, and we get 6 weeks of break where students can actually, maybe we can start seeing these numbers coming down. And I think it's important that we do that. Again, one piece of the overall puzzle.
You write editorials, so not everybody is going to agree with you. There are a lot of parents who are saying the social need vastly outweighs their need to stay healthy, and of course, we can't talk about every side of this, but there are a lot of people that talk about that social need really as primary for these high school students.
It really is, and I started this piece excuse me. I started this piece with talking about my son. My son just last week started back to school after a 14-day break. He's been mostly doing online, just a couple classes up at the school a couple times a week. But he says he misses it, and he's not alone. I mean, these kids need this interaction. But until we control the spread to some degree, they're going to keep ping-ponging back and forth between these 14 days on, 14-day cooling down periods, just because it's so prevalent out there. And we're seeing that again and again. Corner Canyon High went back online. Alta's back online. These school after school after school is going to keep being disrupted in this way, and that's not good either. So I think if we take this break, again, get us to the first of the year, hopefully see a vaccine sometime in the spring, maybe in the summer, and then we can, when school starts again in the fall, we can actually have some normalcy again, and these kids can have the benefits of being in person in school. And I think that I think it is important that they do that.
Some good ideas here, honestly. So Robert Gerke's written in an editorial, as he does every week in today's Salt Lake Tribune. Thanks for talking to us. Appreciate it.
Thanks,
Yeah.
Robert.